keep healthy. So now they're not waiting for the disease to happen again, they're being proactive.
So that's really good. So why is it so important, say, for a diabetic person to treat the chronic infection in their mouth?
Okay, well, there's something that's called the oral systemic link. And what that really means is that mainstream medicine has done a ton of research today and over the last 10, 15, 20 years showing the correlation between chronic infections in the rest of the body. So there is an underpinning that patients can be at risk for heart disease, for diabetes, for inflammatory cancers, for lung problems. Even women who are pregnant can have preterm delivery and low birth weight babies. So a patient who's a diabetic has problems controlling their blood sugar.
Right.
Well, we know that a diabetic is more at risk for having gum disease, but we also know that gum disease affects the patient's ability to control the insulin levels and thus controlling their glucose levels. So if a diabetic has good oral home care and a good treatment program for their gum health, then they would need less insulin and have less problems associated with diabetes.
That makes perfect sense, and I think that, and that goes for other people with different issues going on in their bodies as well. So if someone wants to prevent gum disease or cavities, what are just some more tips that maybe you can...
Okay, so we know that for overall health, right, the pH of the body has to be in a more alkaline state because disease happens when you're acidic. Well, what we do is we have our patients test their morning urine to see what their pH is. And if the pH is too acidic, then we talk to them about eating alkaline foods or about getting enough sleep. There are many reasons why your body is too acidic. So if they're expecting their gums to heal up, for instance, or they're expecting their cavities not to form, as long as they're acidic, they're going to keep forming. Okay, so we work very closely with patients on their diet. If someone doesn't want to get cavities anymore, then sipping on your coffee all day long isn't a good idea.
Not going to help.
Or people who sip on juice all day long. I'm not a fan of coffee or juice, okay? But if you're going to drink it, don't sip on it all day long because now your mouth is constantly being acidic. So drink it quickly, wash your mouth out with some water, and now the pH of the saliva can take over and it can buffer the teeth. And then that will help restore the health.
That's really, really good. And so, okay, so in your office, I mean, or what would you say in general is the importance of the team, a doctor, their staff, the patients? What is the relation, how important is the relationship between the medical doctor and the team, with the patient?
It's very important, and we work very closely with many different doctors depending on what the situation is for the patient. And it's important for the patients also that they are treated by this team approach because so many diseases are caused by a chronic underlying infection. And these doctors know it, but sometimes they don't know to ask the patient what the condition of their mouth is. So it's not just enough, well, go to your dentist and see how your mouth is doing. You have to go to a sustainable dentist or a dentist who at least understands that you need to identify the bacteria the same way you would identify the bacteria if someone has a strep throat. So by doing a very simple test, you'll know if that patient has clearance if they have a cardiac problem, or let's say they have diabetes and they can't be controlled. Well, look at their mouth. Or if a woman is going to be planning on getting pregnant, they should have a cleaning immediately. And then in their second trimester, have another cleaning because you want to maintain that oral cavity free of bacteria.
Is there anything that you can do at home to, besides the nutrition, and is there anything that we can do at home to help prevent?
Sure.
I guess there's rinses or there's different things.
There are.
If you do eat some sugar, maybe brush your teeth real quick afterwards.
Right. Well, first of all, as a sugar, we like xylitol.
Yes.
Okay. But something that you would probably not hear from a dentist, we very rarely recommend flossing. and we tell our
Really?
patients to stop flossing, because if someone has gum disease, your floss does nothing.
Oh my
Okay?
goodness.
There's nothing anti-infectious about a floss, piece of string. So if you have a tonsillitis, your doctor is not going to give you a string and a brush to get rid of your tonsillitis. He's going to give you an antimicrobial. Now, we use natural antimicrobials. So get rid of the floss.
Okay.
Something like a water irrigator, which flushes out the pockets, is wonderful.
Oh, thank you.
But a really important point is you can't, and I've tested this for my patients, you can't go from, I have gum disease and I'm going to do these two things. I'm going to get a water irrigator, I'm going to get a good herbal toothpaste and get rid of my infection. There's something called a biofilm.
Okay.
And it's like a sticky substance that lives underneath the gums. And it has to be disrupted by a trained hygienist who understands this whole biofilm principle. And this way, when the biofilm is disrupted, the bacteria get washed away, and now you're starting with a clean slate, and now the water irrigator, or the herbal toothbrush, and the mouth rinses, or the salt water rinses, or using peroxide and aluminum-free baking soda.
This is just fantastic. And, you know, I just want to thank you. You have a website, right?
Yes.
And people can find you. I'm just so thankful. This was, again, just a plethora of information today. I didn't know that about the flossing, so I'm real excited. And just thank you so much, Dr. Winnig, for being with us today. Thank you so much.
Thank you. It's a pleasure.
Thank you. And we will be right back.
Cafe latte. Thank you. And it says here that vision loss to glaucoma can't be restored.
I heard that glaucoma is the leading cause of blindness for Hispanics and African Americans.
So everyone should get an eye exam at least every 2 years.
Especially people over 60.
Here's your cappuccino.
You might have glaucoma and not even know it. Call 1-800-437-2423 for a free brochure from National Glaucoma Research.
Looking for ways to save